and I'm the founder and CEO of the company. We've been in this space here for just over a year, just under a year actually. But the company was started in June of 2012 as part of an innovation program with funding provided by the Third Frontier Fund of the great state of Ohio. And the advantage of doing that was we were given a very small grant to tackle a significant issue in healthcare, which we'll talk about in a little more detail, of medication adherence. So, unlike some of the conversations you're going to see today, mine's not specifically designed around MedaCheck. It's more designed around the area of the needs of an evolving healthcare system. So, NewCo Cincinnati, if you want to tweet NewCo MC, NewCo Cincinnati. We love Twitter. And the conversation today, the topic is advanced technology and really combating what we feel is healthcare's, or at least one of healthcare's biggest problems, which is medication adherence. So I wanted to start it off with a picture because each of you in this room, or I'm making an assumption, but probably most of you in this room have a primary care physician or have had one in recent years. And I use this picture because in the good old days, this was the type of relationship individuals have with their primary care physician. You walk into the office, you have a conversation. It wasn't a 6-minute conversation, right? Or a 6-minute or less, it's okay. Sometimes it's as much as an hour and you talk to your healthcare provider. I want to kind of pose a question to the group. Take a look at this. Who feels that they have this type of relationship with their healthcare provider right now? They spend up to 30 minutes with them per visit. Can anybody say that that's the case? Yes? 1, 2, 3, 4. I have that situation. Okay. Does your doctor take your vitals? Okay. Checks your weight, takes blood from you, talks to them about their personal life, family, offers them advice about preventive maintenance, answers all their questions, provides like up to an hour with them. It's just not something that we see as much in healthcare these days. Now, I'm very fortunate I have a doctor who does, but I spent a long time since moving to Cincinnati to find a doctor that would do that. And fortunate enough for me, I pay a premium for that, and that is not an accessibility point that all Americans have. And I think that's one of our problems we have. So we look as a solution to that old system in building technology and growing technology and integrating technology within the healthcare systems. And if you look up here, there's just some great examples. My favorite one really is over on the far left, is of a robot. Has anybody experienced the robots yet in hospitals or meeting with doctors? Yeah, it's very interesting. So you can do distance medicine through a device that looks like that. They're all a little different, but it rolls around and you can see the doctor's face and they can be beamed in from another part of the world and be able to diagnose situations and talk with patients. So that's one way. Tablet computing, you start to see a lot of that now, right? As you go into your physician, they're asking you questions, they're entering all your information into a larger database. All that information is collected. What are they doing with all that data? That's the bigger question, right? How is that being useful in the way they treat you? These are all things that are very important. Some vital monitors here. We've started using a device to help you remember to take your medication on the Apple Watch. So one of the first companies locally really to make a lot of advancements in wearable health, which is really important. And then some other vital signs monitors. So having the ability now to take your blood pressure at home and your weight at home and communicate all that data to your physician or your healthcare network to be included in this database of information about your health. And why is that important? How can we utilize that to be more preventive in the way that we treat disease? That's all very important grandparents living a long time. You know, my grandparents didn't live as long as the average Americans now live. So we have all these individuals now, this elderly population over the age of 85. So as you can see there, it will be 19 million above the age of 85 by 2050. And that's up from 5.1 or 5.5 million just 5 years ago. So it's a huge population. And these individuals, if you look out, you know, to the year 2050, they're all going to be utilizing technology. That's a part of the reason they're going to live so long. It's the technology, it's the preventive maintenance, potentially, and the use of pharmacology. So the amazing drugs that we have now to keep us alive so much longer. But what we do find with that pharmacology is that 7 out of 10 of Americans in this age group are on some sort of medication. Right? And in general, half of the population is on something, takes some medication. Needs to be reminded daily that they need to take medication. So we started really looking at this problem in 2012, and over the almost 3 years, have really watched the evolution of the importance, really understanding why medication adherence is important and why individuals need to adhere to their medication. 48% take their medication as prescribed by their doctor. Does anybody other than me fall into that category? Right? You get the penicillin for 2 weeks and you take, what, 6-7 days worth, and the rest goes in the medicine cabinet because you're going to need it sometime, right? No, you need to continue to take the medication. That's that 48%. And that's one of the things in healthcare. You take 6 days worth of penicillin, and in 2 weeks you're sick again with the same thing because you didn't treat the illness the way the doctor prescribed. So that's a problem. That's a big problem. So we see that expanding patient consumer population. Some of the bigger items, and I'm not sure how many of you are involved in the healthcare systems, but healthcare has a big problem right now with readmission penalties with Medicare patients. So as people are discharged from the hospital, they can't be readmitted within 30 days, or there's a penalty to the hospital in the way that they're given their Medicare reimbursements. The biggest issue there is non-adherence to medication after the hospitalization accounts for about 30% of those readmissions. And this is a big area, this is a big problem. Preventive maintenance, preventive management of patients, the ACO model. So less expensive models to really keep people healthy. And that's really the goal, not only medication adherence, but technology changes in healthcare. How do we treat individuals? How do we get them healthier quicker? And how do we keep them healthier longer? So these are some of the drivers. So we start to see really the big issue is we see faster interconnections, more mobile technology, wearable devices or their smartphones are going to want to communicate with their physicians in a way that's most efficient for them, and not only the way that's most efficient for the physicians, as was the case in the past. Again, some more growth drivers. And this is a big one here. 67% of seniors actually want technology in healthcare, and we're really excited to see that. Big challenge, though, is they don't know exactly how to use that technology. They want to use it, they just don't know how. So we worked on that. More than 2 in 3 seniors prefer self-care technology, and they really want to live independently. They don't want to live in homes, whether it's independent living or even assisted living. They want to really stay at their house. And that's really the demographic that we're looking to help in MedaCheck. So, where are some opportunities to make healthcare better? And really the first one is efficiently meeting people where they live and where they want to be, where they work. Preventive maintenance to help support them. We really need to do a better job, and I think this is where you're going to see a lot of technology. How do we integrate healthcare into people's everyday lives? And that's a challenge. It's always been a challenge. Testing and diagnosis without leaving the house. So how can you meet with your doctor right from your kitchen table for maybe a Skype-like conversation? You can treat it for a mental issue, could be anything. Medication adherence improvement. So how can we assure that people are really taking their medication? So Biggest problem in healthcare. We look at this, and I love this chart. So your medication is prescribed by your doctor. Only 88% of those individuals actually get their prescription filled, which is pretty amazing. Doctor prescribes it, they don't always have it filled. From there, you lose another 12% of the people that have it filled, but they don't actually take their medication. And then from there, you jump down another 29% who actually continue to take it through 30 days. Amazing, right? So you break it down from, you visit your doctor, within 30 days, only half the people are taking the medication as prescribed by doctors. It's a terrible, terrible problem. How big is the problem? You can see how big it is right there at the top. Biggest problem in healthcare. So adherence is defined in medicine. It's the extent at which a patient continues the agreed upon mode of treatment under limited supervision when faced with conflicting demands. And the conflicting demands is our everyday lives. Our everyday crazy lives with the cell phones, with the computers and the emails, and everything else you have going on, conference calls, and the devices blowing up. How do you break through all that to ensure that you're taking your medication as important as anything else you do in your life, because it is important. So I was like to put this in after. And really the magnitude of this is so important. Medication adherence is a $360 billion problem in healthcare today. It's one of the biggest problems, if not the biggest. And that's a big, real number. And that number consists of people leaving the hospital, not taking their medications, returning to the hospital for another $26,000 on average every time they're readmitted to the hospital. It's a huge cost to our healthcare system. It's a huge cost to our economy. And we saw this as the biggest challenge that we thought we could make a dent into here at MedaCheck. And that's why we built this product. So our product is an easy-to-use medication management platform that provides the individuals a progressive reminder system to take their medication as a prescribed doctors. And this is our device itself. As you can see, it's very different than your traditional tablet-like devices. What we did with this really was just made it a single-use device. Its only design is to take your medication. When it's time to take your medication, the screen and the volume is off. You must turn the volume. The volume, it comes on, it starts beeping at you, you touch the screen, it brings up a high-resolution picture of the medication, all your dosage information, any messaging that's in there. To indicate that you took your medication, all you do is you hit take, that's it. Same thing, you get a second medication comes up with take. We can also do things on here like check your weight. Sends a reminder, check your weight, enter that information in. Or it's time to refill your prescription. It's just really basic information. What's different about our product than what's traditionally out there on the market too is it's not just an app on a device that we manufactured. It actually communicates all that data back into a system that we call MAP, Medication Application Platform. And all that information is then able to be integrated with other systems and communicate data and reporting across the various networks. So there's all sorts of capabilities there. We also have now the device in the smartphone, right now in iOS. Very, very soon, it will be on Android for use. So how does it work? The progressive remindering approach. The alert is received on your device. So every morning at 7 a.m., my device goes off and tells me it's time to take my Lipitor. If I skip it, I better not skip it too long, because about an hour from then, I'll get a phone call from our call center reminding me to take my medication. The number one adherence solution is actually a phone call. What we wanted to do was integrate at the front end with the digital, so we could actually provide some cost savings and then make it more affordable. In the event that we can't get in touch with that patient, potentially there could be something wrong. They ignored a call from us. They also ignored a text message. We'll send a text message to the caregiver. And the reason we do that is they're the person ultimately that's most responsible for the patient's success in taking their medication. And that's what we call progressive reminder system. And it's what makes MedaCheck different, and what we've found has been really successful in increasing adherence. So what does MAP do? And I talked about it briefly. It allows for the collection of data: age, number of medications, medications prescribed, time, frequency, variation of administration. We can search all sorts of aspects of the product. We utilize a database of over 175,000 different medications. They all have high-resolution pictures that encompass them. The database we use is actually the most widely used database by pharmacies and PBMs. There's various reporting capabilities, so we can customize it to do all sorts of wonderful things. So, simple to use product, set up for medication reminders. It can be on a tablet, it can be on a computer, it can be on a phone, all sorts of capabilities. Unlimited number of medications. We can send reminders up to 15 times, up to 15-minute increments. The ability to take pictures of medications if they're not in our current database, verification of medications and schedules, all sorts of things. Tons of capabilities, and there's even more we can build on that as we grow. Give you an idea of the foundation right now. Our product works, communicates on a mobile platform, caregivers, patients, different individuals. Moving down the road, blood pressure, we can monitor blood pressure at home, weight scales, pulse, all sorts of various Bluetooth-enabled devices. We can take that data and communicate that to caregivers, hospitals, systems, administrators. We can communicate it to insurance companies, whomever's interested in that. So really, we look at it as a conduit of information that's gathered and collected through our program. We look at the competitiveness and the landscape. MedaCheck's not the only company that's focused on medication adherence. There's others as well. We look at those. The majority of them are not focused around the senior population. I think that's one of the big differentiators in what we're doing at MedaCheck that's different. A lot of folks are out there doing medication reminder systems. We look at some of them do all sorts of things, from just reminders to specific notifications. There's other products that are in the market. Anyone that's out in healthcare has probably seen some of these. This one is it's actually kind of hard to see up here, but this is a pill dispensing device. Utilized mostly for controlled substances. It has lockdown capability to it, so you can't get all your drugs at once. They're very, very expensive. That's one of the challenges of them. Some of them are over $600 on average, so it gives you an idea. But that's one area, the security automated alert. Probably one of the most popular products out in the marketplace is a company called Vitality Glow Caps. They've seen a lot of press. It's actually got sensors on it, so when the cap's unscrewed, they can tell that the patient took the medication. The biggest challenge there, though, is that they're not designed for the polymed patient, so people taking over 5 medications can't really use this for somebody who's taking 1 or 2. Pilots have seen success, they've been very successful. Another company that's very similar to this is called Adherence. It's the same thing, smart wireless pill bottles, technology that detects when the patient has not opened the pill. They haven't really integrated with the phone systems and that sort of thing, but they've done pretty well as well in the market space. So that's kind of what the marketplace looks like. Our products that we're looking at working at down the future, I just mentioned earlier, pulse oximeter, blood pressure monitor, thermometer, weight scale, spirometer, and you can kind of see how it all plays in. With Bluetooth technology and ability to connect all this data, we're able to communicate really efficiently with people that in and outside the network through cloud services. Got a lot of customers right now, pilots. We're very excited about these customers. We've seen some great success with Burger Health System. They've been on MedaCheck for over a year now. We've increased adherence dramatically with those individuals. We're also piloting with a program with Price Hospital very soon. It's going to be about 500 users. It's going to be designed around congestive heart failure. We're working on another congestive heart failure pilot with Mercy and Tri-Health Senior Services. Home Instead down in Florida, Burger Healthcare, and then some individual patients with Dr. Zerby right here in Cincinnati. So just some of the things that we have going on, and that's just kind of an overview of medication adherence. I want to thank you all for coming, and of course, open it up for any questions you might have. Yes.
Can you talk, you just mentioned some of your customers, can you talk a little bit, in whatever terms you like, about your pricing and business model, like how are they paying for it, and who's paying for it?
Sure. So, one of the challenges that we look at is, and so I kind of consider myself a senior entrepreneur, or seasoned maybe, because I'm that old. And one of the things that I looked at more than anything else was the ability to secure financing to be able to grow and build a company. And because of that aspect, or having that background, what I recognized quickly was having a business model for not only sustainability but tremendous growth was very important. So understanding that it couldn't necessarily be a product that you sell once, and so really wanted to look at what a recurring revenue model looked like. So the design of our product really is to encourage individuals to get on our product and stay on our product through a monthly subscription service. So the way our pricing works is it's $150 for the hardware device and then a $30 monthly charge for that. Now, if you're just an iPhone user, you can download the product for free. We collect a lot of data from that, which we're able to use in different ways. It's also very profitable. But in addition to that, if you want a calling service, it's $10 a month. So all that reoccurring revenue plays into a model that it's very similar to a PERS model, personal emergency response device model. And those companies have been wildly successful. When we started the company, we had the idea that we're going to save lives and help people, but ultimately we're a venture-backed company. We have a group of investors that want to see us be successful and return on their investment. That's my job. That's why I'm here. So we built the company with that in mind as we start to develop products.
Do you see the patients as your customers or the healthcare providers?
All the above.
Okay.
So in some cases it's different. Healthcare providers have been very interested in our product, especially ACOs and that sort of thing. So anytime that they can see reduction in costs based around offering our service, if we can show a real strong ROI and increase in adherence, they see the value in what we're building.
Right.
Yes?
Can the seniors who are using your products get any kind of insurance reimbursements or something like that?
Sure. So right now, no, but we're working with some insurers that are looking at testing our product to ensure potentially using for reimbursement down the road. So I would say that's something that's coming. We're just starting to see companies in our space that are starting to get reimbursed under different codes for different things.
And what about the incorporation of things like physical therapy and other sorts of wellness? Is that something you're doing?
Not so much now, potentially down the road. Right now, we've really been focusing around some specific disease states, so congestive heart failure, diabetes, and then some of the more specialized issues. Hepatitis is a big one. So sometimes hepatitis regimens can cost as much as $100,000 per patient. So a device like this is a very low cost for them to help them maintain adherence.
What are the barriers that go in the prescription of the program?
There's a lot. So when you start to see that, one of the big ones is cost. So a lot of individuals just they'll meet with their doctor. That's covered. And we live in an economy of individuals that just can't afford an extra $10 sometimes a month for medication. So sometimes that's a big barrier. Sometimes it's the side effects that are involved. So they'll meet with their doctor hoping something else happens, but be given a medication, and side effects of that will discourage them from filling that prescription. And there's a long list of reasons why people don't do it. And it gets very individualized too. But it shocked me when I first learned it. I don't think I've ever not had a prescription filled, and 12% stuff don't get filled, which is a pretty big number.
Jeff, what type of integration do you have with the health systems or the EMR systems?
Yeah, sure. It all depends. So one of the biggest challenges is the fact that we can integrate. The challenge is whether they'll let us integrate. So it's really a case-by-case situation. We're working on a pilot right now with Midmark, which is located out of Midmark, Dayton area, on doing an Epic integration early 2016. Yes, go ahead.
Regarding the actual technology, so that device, I imagine, needs charge at some point. If the device actually goes dead, are you communicating actively with the server, the patient's information, so when they start it back up, they essentially don't start over?
Right. Yeah, all that information is communicated through a cloud. This is a unique demo device. We ask all of our patients actually to keep the devices plugged in at all times.
Oh, okay.
And anyone that uses this device really uses it mostly at home. And these are individuals, I like to use one of our investors and board members. His mother's 88, and she's been using the device for quite a while now. She's been really successful with the device, and one of the things that she tells everyone is, the reason I use MedaCheck is because I don't want my son to worry about that I'm not taking my medication. But what we found out later was the real reason she uses it is she wants to prove to him that she can continue to live independently, so she doesn't have to live in a home. So it's really, it's what's happened, what we've noticed from a psychology perspective is our product was never really designed to have that effect on people, but it has. And the majority of our aging seniors that are using it as a way so they can assure to their family that they're okay to take care of themselves and never take the medicines. It's been a great side effect. And, our team takes a lot of pride too, I would say, in the fact that we can help people live at home where they want to live longer. And that's pretty great, I think. I'm proud of that. I'm proud of our team for this. Do you have any more? You got two questions?
How many subscribers do you have?
It depends on how we look at subscribers, because we've had a lot of people that have kind of come through the system. Our new platform here, this hardware device, we have under 100 people on this. By the end of the year, we're looking at about 5,000 total users on the platform, just to give you an idea of that. This system actually, we have a board member and a woman who's been really instrumental in helping us change this, and she just left, we just missed her. But when she started with the company, we had this great product we felt really good about, and she said, okay, everybody, we need to change it. So we made probably about 90 days worth of changes to it to where it is today. We've had a lot of success with it since then.
What were some of the more significant changes you made?
The biggest change we had was the original version of the product you had programmed through a computer. This version you can program everything right through the tablet. And that was really a game changer for us. You can ask any of the team here, people in the red shirts. They all put in a lot long hours early part of this year on this. Yes?
When you received your funding, how far along did you have your original version of your product, and how many users or customers did you have at that time?
Yeah, so our first round of funding we received in the fall of 2012. We presented at an innovation conference in August 30th, 2012. I walked off the stage, walked over to where our booth was set up, and our first investor came up to me and handed me his card on my back. He says, here's the first investment, $20,000. He goes, I know it's not a lot. I'll wire you the money on Monday, and I've got a whole bunch of friends that'll write you checks for whatever you need, which was really cool. It made me feel like, we did something good here. So at that point, we had only built our prototype, and we'd only been working on it for 90 days. And we had some good success with it, and it was software only. We weren't doing anything with hardware. From there, we raised about $150,000, a little over that actually. And then it took us about 4 or 5 months to realize that it wasn't going to work, because the people really that we needed to work on were seniors. And that's when we made the change in the hardware, and we raised about another $1 million since then, and we're raising more money now. So I think a lot of it is really understanding from an investment perspective, looking at the marketplace in general. Health IT is really hot right now. Investors are really excited about the space. So for us, it was, how do we parallel ourselves with other companies that are doing similar things to what we're doing, and then, how do you value that? So it's not as much about the users as much as it's about core revenues, as much as about the potential in the technology. And that's where we've gotten a lot of traction.
So your 3 years of existence, how many times have you pivoted in terms of kind of making these midterm changes?
We've had, like, I would say, 2 pivots. One would be we went from software to hardware. One we went from being more technically sophisticated to extremely simple. And we don't anticipate any adjustments really from where we're at now. We see a lot of real strong traction in the space that we're in. I mean, I shouldn't say we'll never pivot again, but I don't see any major pivots. We might move into different market segments, but
so maybe the lesson learned though is maybe for us budding entrepreneurs is, be open. Don't feel as though you have the answer right out of the gate, right?
Absolutely. So, and we learn from your customers. And we learn everything from our customers every day. And we constantly, in fact, we just received an email from our business development director, got an email from somebody that was test driving our product. How old was he? 85 years old.
30 minutes a day.
30 minutes a day. He sent us a 2-page email, maybe a page and a half email of all the things he wants changed with our product, which is awesome because we're actually having a big meeting about it next week because as we're reading through, like, that's wrong. But then we're like, wait a second, let's go through all these and really think about them. And potentially, sometimes it's just small tweaks that can change everything for the patient. So our most critical patients have been our most helpful. And actually, we got a great team who's over here. But one of the greatest things that we've done, I think, as a company that wasn't in my presentation, is we've done a really good job at listening to our customers and really listening. Even when they tell you, your baby's ugly and it doesn't work and all these different things, it's taking what is it that's actually constructive in the criticism and making positive adjustments to your product. And that is sometimes harder than it sounds. Our team's done a great job. We're constantly reminding ourselves not to take those types of criticisms personally. It's hard. You just spend a lot of time, it becomes a very intimate part of you. It's hard to make those adjustments, feel good about it. That's a very huge, I guess you could say, humanistic. Yeah, that's what's human about building products. Even though there's so much technology involved, it's still very emotional. Would you agree?
Yeah. So what does future look like for you? Are we trying to distribute these in pharmacies, to the healthcare providers?
Yeah, so our go-to-market strategy really is defined more around healthcare networks and systems, and then that's one track, and then another track really is direct to consumers through just direct channels. But really, it's just getting the platform out into as many people's hands as possible and collecting a lot of information. That's where we see the real value in the company as we grow. And there's a lot of different approaches companies in our space take. Some of them get really hyper-focused on specific disease states. Some of them get hyper-focused at going after insurers, and we've taken more of a broad approach and had pretty good success. We're still trying to really focus on understanding who our, I guess you could say, our specific targeted demographic is. We're not sure yet. I feel really confident telling you that we're not sure. Anyone else? Well, I thank you all for coming. Appreciate it. I hope you're enjoying the NewCo experience. Feel free to, I have some of my cards up here. Feel free to reach out if there's anything I can answer any of your questions or be helpful in any way. People don't need.
And that just the spaces on the work or the startup here, is it anything you can do?
I'm sorry?
The space, how did in this space?
Oh, how did we get here?
Yeah.
So one of our investors actually was friends with the previous owner of the building. And we previously were at Centrifuge across the street and really liked the central business district and talked to a lot of and some of our employees that really wanted to be downtown. There's a cool energy about it. And so we just we leased the building, we leased this space about early decimal. And then we're here, and then it's there's a couple other startups in this building too. Zipscene's up on 9, Skinny Mounts down around the hall, and then there's a whole bunch of other little startups throughout the building. But it's just a privately owned building.
So do you guys interact with the other startups?
It's really funny, we do. So I know Smear, the CEO of Zipscene, but I knew him before we moved in. I knew him pretty well from Skinny Mount, but some of it's just you walk into people in the hall and get to know them.
How do you maintain any relationships you have built with centuries or do you
Yeah,
move around?
yeah, you know, I think what's really powerful and exciting about the ecosystem here in Cincinnati is there's a real sense of camaraderie, and there's a real sense, I think, of excitement around the identity of growing an ecosystem. And I've lived in New York, I've been in other parts of the country, in Toronto. I've never experienced that. Just to give you a quick background, my PhD dissertation is in small business incubators. So I studied about over 100 incubators throughout the country, really focusing on small business communities and ecosystems. And I've been a big proponent of what's happening here in Cincinnati, especially since when Lee has come to Centrifuge. I feel like this ecosystem is exploding for a size city like this, unlike anything I've ever seen. And it's really exciting to be a part of it. And just to address your previous question, we spend a lot of time with other entrepreneurs in the ecosystem, whether they're in our space, whether they're help IT, or we could be in very different spaces. And I think a lot of the way Centrifuge is building the new space up on Vine, and there's the Brandry and Uptech and some other organizations. Everyone's done a really good job of building community. And I think that's something that will continue, and we're really excited to be proud of, a part of. Would anybody disagree with that? Anything else? Any other questions? Thank you all for coming. Appreciate it. Yes. Let us know if we can be of help. And all the MedaCheck folks here are in red. Red Stark Cincy shirts that Centrifuge was gracious enough to give us. So feel free to ask them if you have any questions too. And thank you, Carrie did all the heavy lifting on this. She set this whole